Welcome back to Law and Crime. We are continuing our coverage out of Sarasota County for the Florida trial. It's a civil trial against Johns Hopkins All Children's Hospital. You were just listening to the cross-examination of neurologist Dr. Carl Barr. So let's head back into court and listen to some more of that testimony.
I believe that's all I have for now. Thank you, sir.
Dr. Barr, was my Kowalski's history and physical consistent with complex regional pain syndrome?
Yes.
And although challenged on...
You may continue, Mr. Hunter.
Thank you, Your Honor. Who did you understand would be giving the outpatient IV treatment to this young lady?
I think it was arranged through a company called Quorum.
Let me ask you a couple of questions about your findings when you examined this child in February of 2016. And I'd ask you to refer to, I asked my assistant, my helper over here, to put up 1039-18. We talked about what findings you didn't have consistent with CRPS. We haven't talked about what findings you did have with respect to your physical examination on this patient on the only visit you saw her, February 12th of 2016. She was denying joint pain and joint swelling?
Correct.
And joint redness or sports injury, correct?
Yes, as far as I can recall.
And she was using a wheelchair?
Correct.
And she denied anxiety, depression, developmental delay, behavior problems, mood changes, and inpatient admits?
Correct.
Is that right?
Correct.
Right. And she had a complaint of eczema. What is that?
It's an inflammatory skin condition which causes lesions and a typical pattern, usually red, scaly, cracked.
You didn't find any of that this particular day?
I did not.
Okay. And then generally she appeared well, appropriate for age, but appeared to be in pain and was moaning throughout most of the visit, correct?
Correct.
All right. Now, I'll skip the head, eyes, nose, mouth, neck, lungs part of this, as well as the heart and abdomen. All that was normal.
Correct.
And then you found that her muscle bulk and tone were normal for age?
Correct.
And then if we go over to 19, it looks like you found with the motor examination, with skipping over some other normal stuff here, that in the motor exam for strength, you note that she had muscle bulk, tone, and strength are normal, correct?
Correct.
Okay. And you were able to perform a deep tendon reflex examination, correct?
Yes, but she was not comfortable with doing that.
She wasn't very happy about it.
No.
And if I'm understanding your testimony correctly, this was the only time that you personally saw this patient.
That is correct.
Check my notes here, Doctor. I may be through.
I'm sorry?
I said, let me check my notes. I believe that's all I have for now. Thank you, sir.
Dr. Barr, was Mike Kowalski's history and physical consistent with complex regional pain syndrome?
Yes.
And although challenged on this point, dystonia is an objective sign of complex regional pain syndrome, is it not?
Yes.
And whatever your scribe took down, you observed dystonia on that visit in February 2016.
Yes.
There is no definitive way to diagnose complex regional pain syndrome. Is that true?
Objection, you're leading your own. Overruled on that question.
Can I answer?
You can answer. Yes.
There's guidelines that are established, but there's no definitive test for complex regional
The
pain.
jury's familiar with the guidelines. Are you referring to the Budapest guidelines?
Yes, correct.
And the Budapest guidelines are a constellation of symptoms, are they not?
Symptoms and signs, yes,
All
correct.
right. So, counsel focused on the fact that many of the symptoms that would lead to an initial diagnosis of complex regional pain syndrome, which Maya Kowalski received in September 2015, were no longer present during your exam in February of 2016.
Correct. Not that I elicited, yes.
And you were aware, based on Beata's relation of the history, that she had already undergone ketamine treatments, both by Dr. Kirkpatrick and in Mexico on 2 occasions.
Correct.
So, is complex regional pain syndrome a fluid disease, meaning symptoms wax and wane?
Correct.
The fact that many of Maya Kowalski's initial symptoms that led to the diagnosis of CRPS in 2015 were not present on your examination in 2016, would you agree that that's evidence that the ketamine treatments by both Dr. Kirkpatrick and Dr. Cantu had a positive effect on Maya Kowalski?
Object to leading. I sustain that one.
What is your assessment of the fact that many of the constellation of symptoms were no longer present during your exam in February 2016 after initial ketamine treatments?
I'm sorry, I don't know that I understand what you're asking me.
Let me slow down. You've already testified that the symptoms, the signs, complex regional pain syndrome wax and wane over time.
Correct.
If a patient is diagnosed 6 months to you seeing them and they receive a subsequent course of treatments, is it surprising to you or not that some of those symptoms might not be present during your examination?
It's not surprising. The hallmark of when we treat a patient is we have an observation, we institute a treatment, and then we reevaluate. And so what you would like to see is that there's improvement when you do an intervention like that. And that should guide you on whether to proceed or whether to try something else.
You testified that you agreed with the diagnosis of complex regional pain syndrome. Did I hear that?
Correct.
What would happen in your practice if you refuted a diagnosis of complex regional pain syndrome, but billed for services for complex regional pain syndrome?
Object to form, Your Honor. Lack of predicate and compound.
She hasn't finished the question yet. Why don't you re-ask the question?
Doctor, what would happen in your practice if you refuted the diagnosis of complex regional pain syndrome and then submitted treatment bills for the treatment of complex regional pain syndrome?
Object. I believe that's all I have for now. Thank you, sir.
Dr. Barr, was Maya Kowalski's history and physical consistent with complex regional pain syndrome?
Yes.
And although challenged on this point,
Okay, I have with me this hour Miguel Custodio and Catherine Lizardo. And Catherine, I'm going to start with you very quickly. We saw some direct, we saw some cross, we saw some redirect. One of the things that the four of us, were talking about during the break is they're establishing that this particular physician, Dr. Carl Barr, did not see the patient on a regular basis, only saw the patient once, didn't look at all the records, didn't review the hospital records and the notes. Is that important for this type of witness? This is a treating physician. This is not an expert. So Cross is trying to make it seem like he was supposed to be looking at all of those records. Does he have to?
Well, I take issue with the cross by the defense here because he does not have to look at the John Hopkins records, which is the defense is implying he should have, but he should not because, like you mentioned, he is testifying as a treating doctor of Maya. He treated Maya once, and that's why he's there providing his testimony as to what his treatment and diagnosis was on February 16. On February 2016. And then Maya was seen at John Hopkins afterwards. So he doesn't have to review those records. Now, I take issue with that because he's not supposed to review them. So why is the defense trying to manipulate the jury to think that he should have? That's why lawyers get a bad reputation when we try to manipulate information like that.
Right. I think the jury right now is thinking that this doctor did not do his job. And I do think one of the things that the plaintiff's attorney is going to have to do is to make sure that that jury understands what the role of the treating physician is. Now, having said that, Miguel, I don't think that this doctor is really helping the plaintiff's case. Remember, the Kowalskis are suing for, malpractice, negligence, and intentional infliction of emotional distress. They're trying to say that the hospital did not do their job. They misdiagnosed. They didn't say that she had CRPS when she really did, and later, they sort of admitted it. But I don't see this physician really helping the plaintiff's case. Do you see any points that they've made here?
It was a great cross, in the art of lawyering, trial lawyer. I thought this was really great cross. As a treater, he doesn't have to, right? We've already talked about that, but the jury doesn't know that, right? And so the jury is seeing MD, neurologist, specialist, take the stand, and he's just answering a bunch of, have you reviewed medical records? Have you reviewed? And they're all in the negative. No, I haven't. No, I haven't. No, I haven't. The jury, right? Jury's lay people, they are just thinking to themselves, I guarantee you, they're thinking, wow, he's not prepared, and now he's making some, allegations or he's giving his opinion that he does agree that she had CRPS when he only saw her once. I mean, I thought that was a great question that the defense counsel asked, and he then paused. So, and that was the last question that he had on his cross. I thought it was really good. There was a lot of points that were brought out by the defense. I really think for this witness, it was not good for the plaintiffs at all.
I agree. I think at the end of the day, the jury is going to look at Dr. Carl Barr and think that he did not help the plaintiff's case, did not establish all of the elements of the various claims. And so when we come back, we're going to take a quick break right now, but we'll dig into this case and other cases. Stay with us here on Law and Crime.